Good morning. I know I said this last week and I said it yesterday, and I'm going to say it again today. Everyone needs to stay at home unless you're going out for an essential reason. We have way too many people outside aimlessly and too many residents out in public without a mask. Every time you leave your house, you put yourself and everyone in your household at risk. This includes everyone you come into contact with too, your family, your friends, your neighbors. We must keep our social distancing and mitigation practices to continue flattening the curve. Now to the business of the day. I'm happy to announce that the Department of Planning has developed a Baltimore City Census 2020 live response dashboard as part of our community engagement strategy. This live dashboard updates the city's total census response rate along with all 199 census tracts within the city. It also has selectable boundaries to help shape the map, such as planning districts, council districts, neighborhoods, and legislative districts. Users can also input an address to have the map zoom and reflect census rates for that specific area. The dashboard will be located on the census2020.baltimorecity.gov main page. Again, census2020.baltimorecity.gov main page. I encourage all residents to use this tool to track their community census response and to urge their friends, neighbors, and family to complete the census before June 1st. As of right now, Baltimore is at 44.6% household response and leading many major cities in our peer group, including St. Louis, Philadelphia, Los Angeles, Detroit, New York, Cleveland, Providence, Newark, and Miami. But some are gaining on us, so we need to stay focused to meet our goal of 73% household response. Since the onset of COVID-19, the city has still been able to participate in a half dozen virtual events and town halls, conveying the importance of completing the 2020 census to hundreds of city residents. We have also successfully launched the Census Community Grant Program, awarding over $100,000 to 30 minority-owned businesses, churches, community, grassroots organizations, and small nonprofits. This helped bring critical money, access, and recourse directly into Baltimore's communities. Their work has included incorporating census materials with food distribution sites, phone banking, and virtual outreach. I want to sincerely thank these 30 groups for their continued work in partnership with the city. So once again, while you're staying home and staying safe, please take 10 minutes to complete the census. It is vitally important. And now, before I open it up for questions, I've asked Commissioner Harrison to provide us with a public safety update. Commissioner.
Good morning, and thank you, Mr. Mayor. Even during the midst of the COVID-19 pandemic, the men and women of the Baltimore Police Department remain committed to protecting and answering the call of service to the citizens and residents of Baltimore. Since the beginning of the state of emergency, our officers have continued to patrol the streets with astounding resolve. Since March 15th, our officers have seized 165 illegal firearms, and we have made 124 gun arrests of suspects directly associated with criminal activity. This includes drug activity, robberies, and other violent acts. Our detectives continue to diligently investigate violent crimes and prepare good cases. To that end, again, since March 15th, the beginning of the state of emergency, our detectives have arrested 19 murder suspects and 10 non-fatal shooting suspects. And with these arrests, our homicide cumulative clearance rate is now at 60%, significantly higher than where we were at the end of 2019. So during this same time period, our detectives have arrested 84 robbery suspects to include 67 adults and 17 juveniles. As a result of these arrests, we have been able to close 88 robbery cases. So while we continue to make great strides in reducing crime, this success is not ours alone. We want to thank our communities for their continuing to step up and come forward with much needed information to help us close these cases. We also continue to work with all of our law enforcement partners at the federal, state, and local levels to share information, to assist with enforcement, and support us in our efforts to change this culture of violence that our officers face every day. We will continue to build on this momentum as we remain laser focused in apprehending violent offenders and holding them accountable. So I want to thank all the members of our police department for their continued service and unwavering dedication, even during this pandemic. We continue to urge our residents, if you see something, say something. You can call Metro Crime Stoppers to provide anonymous tips at 1-866-7-LOCK-UP. Thank you. I'll turn it back over to our mayor.
Thank you, Commissioner. Thank you to all the men and women of the Baltimore Police Department for continuing to go out every day during this pandemic to safeguard the residents of our city. And I want to thank all of our first responders and all of our citizens that are paying attention to the message that's coming from our health professionals. At this time, we'll take some questions.
Can we ask the Commissioner just a clarification on the clearance rate? Is that to date? Tell me how that works, with how you calculate.
That is the 2020 clearance rate year to date, yes.
How has the coronavirus changed census outreach in the way that you're going about getting that number?
We have Stephanie Smith, Delegate Stephanie Smith.
Good morning. One of the main things we've had to do with our recipients of the census grant, the communities that are representing hard to count, populations, is we've had to shift to some different methods of outreach. They were all expecting a lot of high touch, in-person, events that are unfortunately not going to happen. So we've morphed into phone banking, something that's tried and true. Another thing that we've done is that a lot of these communities, they're already the go-to community organizations for relief, for food, for help, for assistance. So now we're just finding a way to dovetail any type of relief they're providing to their neighbors with some messages about the census, and also working with our mayor's office and as well as other agencies that are engaged in different relief efforts to see how we can put stickers informing people of the ways they can participate in the census on food boxes, for example. How can we, for folks, there are some religious institutions that are passing out food, for example, and they've been able to set up laptops where people can one by one complete their census that maybe otherwise have difficulty completing that online. So we're just trying to adapt to some of the limitations about people coming together in mass. But thankfully, the fact that this is the first time the census can be completed online and also meaningfully by phone, the phone has been, I think, a great unifier because many people know how to use a phone and many people can be reached by phone.
Mayor, with all the concern over nursing homes, I think nursing homes, the city has, I think, the third highest number of cases in the state when it comes to nursing homes. Is there a sort of change in strategy or any sort of additional plan that needs to be in place to sort of tackle that?
Malcolm Haynes, Baltimore City Health Department Chief of Staff. So the strategy with respect to nursing homes and assisted living facilities in Baltimore City is really just trying to concentrate resources onto those facilities, and that means providing both public health support as well as medical support. We've partnered with the state of Maryland and the Department of Health, as you probably know, around providing strike teams and concentrating our efforts on those. Similarly, with respect to our case investigations side, we've also concentrated resources within our department to assign case investigators to each of our assisted living facilities, whether they experience an outbreak or not, in order to ensure that we're both preventing and quickly intervening in instances where there are outbreaks.
For nursing homes where staff members work at multiple facilities, what are you doing to make sure contact tracing is in place if they may be asymptomatic?
Are you speaking about staff specifically, or?
If they're going between different nursing homes.
Yeah, so again, we are focusing our case investigations work on assisted living facilities and nursing homes. So we have assigned case investigation staff for each nursing home to ensure that the infectious disease protocols are adhered to, regardless of where the staff work outside of that specific institution.
Anything else?
Can we ask the mayor a political question?
This is a non-political event.
Okay, can I talk to you afterwards?
You can talk to me afterwards, Sharon.
No problem.
All right, thank you.